Hi guys, welcome to our upper limb tutorials. Today we're going to talk about the pectoral region. So the pectoral region is a very important region because it has muscles that affects the movement or the action of your upper limb. So this is your pectoral region. As you can see, um, it is going to have these muscles. You can see these complex muscles that are very important in the movement of your upper limb. What are the objectives? So basically, at the end of this lecture, the student should be able to, one, identify and describe the muscles of the pectoral region. You have to know and describe these muscles by the head. You have to know the pectoralis major, the latissimus dorsi, the pectoralis minor, the subclavius, the trapezius, the rhomboids, the levator scapulae, and the sternocleidomastoid, lastly the serratus anterior. So these are the muscles that comprises your pectoral region. Very important muscle. So for each muscle, you need to know the innervation, its origin, its insertion, its action. Right? So now let's start with the pec major, the pectoralis major. So whenever you see a major, it means there is a minor. Right? So the pectoralis major, there is also what? A minor. So this is your pectoralis major muscle, right? It is going to have two heads. It is going to have a clavicular head and a sternal head. So this is your sternum. So it originates from here, from the sternum. It originates from the medial half of your clavicle, and then it inserts on the lateral lip of your bicipital groove. Remember, we said when we did the histology of the humerus, we said we have a bicipital groove that is a floor and two lips, right? The lid that sits between two majors, right? So you're going to have one of the major is the pectoralis major that will be attaching to the lateral lip of your bicipital groove, right? So origin, it has two heads, a clavicular head. So the clavicular head is from the medial half of the front of the clavicle, right here, right here. That's where your origin is for the clavicular head, right? And then you're going to have your sternoclavicular, your sternocostal head. So this is going to originate from the costal cartilage as well as your sternum, right? So you have the sternum and the upper six costal cartilages. So it will be originating from the sternum and the upper six costal cartilages. So it's also very important that it also originates from the upper neurosis of the external oblique. So in the abdomen, there's a muscle called an external oblique, right? So this all comprises the sternocostal head. So the sternocostal head is the sternum, is upper six costal cartilages, and the upper neurosis of the external oblique muscle, right? So here, right here, that's where the origin is, right? That is where the origin is. What about insertion? So insertion, remember you have a bicipital groove right here. So your bicipital groove is going to be made by two lips and a floor, and the pec major attaches to the lateral lip of the bicipital groove, right? So this is a point of insertion. This is your lateral lip of the bicipital groove. What about nerve supply? So the pectoralis major is going to be supplied by two nerves. So it has two origins, then it has also two nerves. You're going to have a lateral and medial pectoral nerves, right? So we are going to talk about the brachial plexus, and you're going to see where these nerves are coming from. But for the time being, know that they are coming from the medial and the lateral pectoral nerve. What about the action? What is the action of the pectoralis major? So the pectoralis major, it is a muscle of adduction, right? It pulls the humerus towards the midline, and it also pulls the head of the humerus towards the midline, thereby forming a rotatory movement, which is termed to be medial rotation. So it adducts when it contracts. Remember, a muscle always contracts it all towards its origin. This is the origin, so it contracts going this way. So it will move the humerus towards the median plane, that is adduction, and then it also rotates the head of the humerus, forming what by the action called medial rotation, right? So we also have the clavicular head. Remember, here is where this is where the clavicular head here. So the clavicular head helps inflection of the arm, inflection of the arm. So this portion, if it contracts, it will pull the arm, forming a flexion action. So what are the actions of the pectoralis major? Three action. One, adduction. Two, medial rotation. Three, flexion. Easy, right? Let us now go to the pectoralis minor. So here is your pectoralis minor. Your pectoralis minor muscle, it is uh, underlining the pectoralis major. So you're going to have the pectoralis major superficial, and deep to the pectoralis major, you have the pectoralis minor. It is going to originate from the third and the fourth and the fifth rib and their costal cartilages, and then they're gonna insert on a a a, a prominence called the coracoid process of the scapula. So the origin from the third, fourth, fifth ribs close to their intercostal spaces. Insertion, the coracoid process of the scapula. Nerve supply. So you have to take note of this. The pectoralis major is supplied by two nerves, the lateral and medial pectoral nerve. But as for the pectoralis minor, it is innervated by the medial pectoral nerve. Right? Action. What is the action? So, first action is that it depresses the shoulder. Remember, a muscle always contracts towards its origin. This is the origin. So when it contracts, it will depress the shoulder, right? And also, it draws the ribs upwards. You're going to see it when you do thoracic anatomy. It is also used in inspiration, in forced inspiration, whereby it can pull these ribs upwards, right? And uh, decreasing interthoracic pressure, thereby causing what you call inspiration. Those are the action: depression of the rib, drawing of the depression of the shoulder, drawing of the ribs upwards and outward during forced deep inspiration. Right. So you can see clearly here. So this is your pectoralis minor muscle. You can see it, right? Very, very clear. Attaching to the coracoid process, originating from upper three rib and their intercostal spaces, innervated by the medial pectoral nerve. Its action, first action, it depresses the shoulder. The second action, it draws the ribs upwards and outward, facilitating inspiration. Done. Right, let's go to the subclavius. So if you looked, remember we said the superior border of the clavicle is smooth, but the inferior border of the clavicle is rough because it is a groove for the subclavius muscle, right? So as you can see here, this is your subclavius muscle, right? This is your clavicle, right? So remember your subclavius muscle, it is it inserts on the inferior surface of the clavicle, right? Its origin. So it originates from the first rib. So this is the first rib, right? It originates from the first rib. Sorry. It originates from the first rib at its junction between the costal cartilage and the first rib. You see? So this is your first rib. Sorry. This is your first rib. This is your costal cartilage of the first rib. Between the on their junction, that's where you have the origin. And then it's gonna insert on the subclavian groove, right? At the medial at the middle one third of the inferior surface of the clavicle. Remember the inferior surface of the clavicle the clavicle is divided into 3 thirds, right? You have the medial third, and lateral third. So inferior to the middle third, you have what you call the subclavian groove. That's where this muscle attaches. Nerve supply. Nerve supply is just very simple. Nerve to the subclavius. This is one of the simplest muscle that you should never forget. Nerve supply, because its nerve is a name of the muscle. Nerve to the subclavius, which is coming from the upper trunk of the brachial plexus. We are going to talk about it. Upper trunk of the brachial plexus, which is C5, C6, right? We'll talk about it. The action, it's fixed. So it's an important action. Remember, it attaches the first rib. So during inspiration, we raise the ribs, right? There are muscles that are involved in inspiration. But as we are raising the ribs, we don't want these ribs to get or to get into the neck. So the first rib has to be fixed, right? So what fixed the first rib? So one of the muscles that is fixed the first rib is this muscle, the subclavius muscle, right? It fixed the what? The first rib during inspiration. And also, it also fixed the what? The clavicle during movement of the shoulder joint, right? So remember, the shoulder joint is one of those joints that are very they are less stable. So which means they are mobile. So when this joint is moving, we need to fix the clavicle, and this is the muscle that also fixes the clavicle, right? Another important thing is a fascia, what's called the clavipectoral fascia. So you're going to understand that your pectoralis minor, your subclavius, they are going to be enclosed by a fascia. This fascia, you can see this whitish layer, right? This is your what? Your fascia. So this is called the clavipectoral fascia. So it is a thickened membrane of deep fascia that is between the subclavius, right? You can see this is your subclavius, right? And your what? And your pectoralis minor, right? So this fascia is very important uh, because you're going to find that it comes, its boundaries, right? It comes from the clavicle, right? And then it encloses the what? The subclavius, and then it expands and then encloses your you can see here, it comes from the clavicle, it encloses your subclavius, and then it descends, right? As it descends laterally, and then it encloses your pec minor, right? And then as from the pec minor is going to attach to the floor of the axillary, what you call the axillary floor, right? So that fascia that is between the pectoralis minor and the axillary floor is what you call the suspensory ligament. So this will become the suspensory ligament. This will be the suspensory ligament that will be going to the what? To the floor of your axilla, or to the deep fascia of the armpit. So there are structures that pierces this clavipectoral fascia, right? So they are very simple. There are just four of them, right? There are what? There are four of them. So you're going to have this. We will talk about it later. The cephalic vein. So the cephalic vein that will be coming from your upper limb, your lateral portion of the upper limb, it will pierce the clavipectoral fascia as it joins the axillary vein, right? And then we have the thoracoacromial artery. So the thoracoacromial artery is a branch of the axillary artery from its second part. So this thoracoacromial artery, it has three more branches. It gives three more branches, and some of each branches they will pierce the clavipectoral fascia, right? And then you're going to have your lateral pectoral nerve. Remember, we said the lateral pectoral nerve. The lateral pectoral nerve, it only supplies the pectoralis major. It does not supply the pec minor. So it has to leave the pec minor, piercing the what? It has to leave the the brachial plexus, piercing the cleft pectoral fascia, innervating the what? The pec major. We cannot see the pec major here, but this is a reflect. You can see this is one of a part of its fibers that have been cut off to expose the pec minor in the cleft pectoral fascia. We also have a few lymph nodes. To be more specifically, these are your infraclavicular lymph vessels, not nodes, lymph vessels, right? We'll talk about it later, right? So let us go to your serratus anterior. Your serratus anterior muscle, it looks like a saw. You can see it looks like a saw, right? With the teeth, you can see. So it's going to attach the lateral aspect of your thorax, but attaching to the upper eight ribs, right? So from 1 to rib number 8, that will be its origin. And then it's going to insert, right, on the anterior aspect of the medial border in the inferior end of the scapula. If you remember, we said when we were describing the scapula, you can see this is your scapula, right? So this is your lateral, this is your lateral border, this is your medial border. So this blue area, that is where your serratus anterior attach, your medial border and your inferior ankle. That's where your serratus anterior attaches, right? And remember, we said the nerve that supplies the serratus anterior is the long thoracic nerve. And we said that if the long thoracic nerve is cut via radiomastectomy, whereby removing the cancer of the breast, the long thoracic nerve is going to cause the paralysis of the serratus anterior, leading to what we call wing scapula, whereby your inferior ankle of the scapula, it will protrude outside and it will be very visible. What is the action of the serratus anterior? I want you to take note of this. It's very important. So since it attaches here, right, it will draw it will draw the scapula forward. So when it contracts, right, it's gonna push the scapula forward. That is what you call protrusion. Especially when you are punching someone in a box in boxing, right? Your upper limb your upper limb or your fist has to go forward, and that forward movement is what you call protrusion, and it is done by the serratus anterior. And also it facilitates abduction of your upper limb, right, above 90 degrees. Above 90 degrees, we are going to talk about it uh later when we are going to speak of the deltoid, because the infraspinatus, the supraspinatus, it initiates abduction from 0 to 15 degrees, and then from 15 to 90 you have your deltoid muscle, and then above 90 you now have your serratus anterior as well as your trapezius muscle, right, rotating, giving abduction of your arm above 90 degrees. Right, so these are the main muscles that you have to take note of, right, of your pectoral region. So muscles of the pectoral region are connected to the upper limb with anterior and lateral thoracic wall. We have seen it. The main muscles are the pectoralis major, minor, subclavius, serratus anterior, right? So in our later session, we're going to talk about the axilla, right? So basically, the axilla is an area or a space, or which is more specifically, it's a pyramidal space which is situated right between your upper part of the arm and the side of the chest. It has four walls or four borders: anterior, posterior, medial, and lateral, and also has the apex and the base. And there are also contents or things that are very essential that will be within the axilla that we are going to talk about. So just for a glimpse, the axilla is going to contain axillary vessels, that is your axillary artery, axillary vein, right? And then it's going to have important cords for your brachial plexus, right, which will be coming from C5 to T1. And it's also going to have your axillary lymph nodes, 5 axillary lymph nodes. We're going to talk about it in the axilla, in the lecture of the axilla.